Hi, it's Ginny Fey with Real Estate One, and I am here interviewing Aubrey Jabour. Aubrey owns a company called Northbound Physical Therapy and Wellness.
Yep.
I have heard wonderful things about it, but tell me, when did you start this company and what got you into it, and what differentiates you from other physical therapists? Boy, that's a mouthful, but yeah.
I'm here for it all. I started my business during the pandemic. I was ready for a change. I was ready to find a little more autonomy in what I was doing as a provider, and looking for some more maybe work-life balance, which I'm still working on that part.
What were you doing before you started the company?
I was working in Kodiak, Alaska for a small outpatient clinic there, and I loved living in Kodiak, but I was also ready to be in a less rural area. You know, Traverse City, we're not a massive city by any means.
No, but it's less than
but
Kodiak.
My joke is that, you know, I just wanted to live somewhere with a Target. So here I am. I started this business. What sets me apart is that I'm offering house calls. So I am instead of someone going to an outpatient clinic, I can come to see you in your home.
That's huge.
And so I'm offering really personalized care because I'm seeing you in your environment. Like, that set of stairs is difficult for you to do. Let's do it. Or, you know, you want to go to your mailbox and you have to navigate these obstacles. We can problem solve that very specifically.
Wow, that's pretty cool. Because I know when I've been to physical therapy before, but I always had to go to a place where they did that. And I had a lot of back pain at the time, and walking was very difficult for me. So just getting there and getting back home was terrible. You coming to the house, I wish I had known you back then.
Yes, me too.
I know, because so anyway, we won't go into me, but we're going to talk more about you.
Well, that's a great point, that you not only had pain to get to the clinic, but then how does that translate for you when you get some exercises to do at home? It's not always the same to, you know, learn something on the mat table and then have to apply it to do in your bed.
You're right.
Which is very different surfaces. So we get to do that home piece, and I usually tell my patients, sorry on the mic, I'm your coach. The main part of the work that we do together is going to be me coaching you to heal yourself, essentially, because it takes that consistency. And so we are going to come up with strategies to help you be consistent with your exercises, and then do them in your environment in a way that is going to be effective and actually get you results. That
is awesome. I heard you talk to someone else about a story that you had about a lady, and would you tell us about that?
I like to tell this story because it illustrates the power of this profession, the physical therapy profession, which, by the way, 97% of people who would benefit from the services of a physical therapist never get to see one. And that's primarily in like the orthopedic and pain realm. So people,
why don't they get to see one?
Because it's not we don't really appreciate the full capacity that we have to offer, or we wait so long. We wait until the pain is affecting our life, where it's interrupting our ability to care for our kids or go to work or engage in the things we enjoy. So one thing I advocate for is PT early, PT first. It should, for musculoskeletal, for pain, for anything where you're starting to notice you're having an issue that is starting to impair how you participate in your life and the things that are meaningful to you. Talk to a physical therapist. We should be on that team of people. You have your dentist, you have your eye doctor, you have your primary care doctor. Your physical therapist cares for your frame. So that's part of my soapbox that I want to stand on before I tell this story. But the patient that you're referencing is a person who is out in Benton County. and was experiencing severe mid-back pain.
Excuse me, I don't mean to interrupt, but
Yeah.
but just for a reference, how far is Benzie County from Traverse City?
So this person was like a 30-minute or more drive for me. So that's not a distance I can accommodate
Right.
on a weekly basis. But they were on the wait list for months, and they were in extreme pain. They were waiting to get imaging, and most insurances, they want you to see therapy first. So I said, I can't see you every week, but I'll come see you once in person, and then we'll do virtual follow-ups. And so we did. And after 4 sessions, this person said they had an 80% improvement in their
Wow.
symptoms. She was so excited. She is like, this woman is my biggest fan now. I
How old
adore
was
her. She's in her 70s.
Oh my gosh.
And so she was a little hesitant that that telehealth would work for her, but she had a smartphone, she had support from her family, and it was able to work out really well. So I saw her for a couple more sessions after that, and we were able to get her established on a plan of what to do if this comes back, and just how to continue to be active enough to prevent it from returning. So
That's awesome.
I got to meet her where she was, got to increase her access to the care that she needed, reduce her pain, and she didn't need that MRI anymore. So
Wow.
limiting
That
expenses.
is quite the story. So, oh my gosh. So if any of you are having pain for anything, don't wait. Don't hesitate. Give Aubrey a call.
Absolutely.
Yeah. So speaking of that, how can they get a hold of you?
You can give me a call, leave a message. My phone number is 231-331-3311. It's very
Lots of
repetitive.
threes.
You'll know it's me.
Say that one more time.
231-331-3311.
Okay. And website, do you have one?
Yes, it is northboundpt.com.
Very good. Okay, I highly encourage you. Give her a call if you're in any kind of pain whatsoever, or also if you're in a work environment where possibly you don't know if this chair is right or certain things at the work, she can come in there and actually do an assessment of that office, correct?
Yeah, so I'm getting into ergonomic assessments in the office settings, healthcare, industrial settings to prevent injuries from happening in the first place. And most of us spend so much time at our jobs that can be a common place where things that we're doing without even necessarily being aware that it's happening, that is influencing pain.
Right.
Yeah,
Okay,
so I'm very excited about that.
All right, excellent. Okay, well, thank you very much. It was a
Thanks
pleasure
for having
talking
me.
to you. Yeah, and I hope you call her because she is awesome. So talk to you soon. Ginny Fey, Real Estate One. Bye now.